Good afternoon and welcome to today's webinar, Cancer Support Services. Today you will learn about psychiatry, oncology, social work, and survivorship services available at Providence Saint John Health Center. And now I'd like to introduce myself and our other presenters. My name is Dr. Shanti Nathan, and I am a psycho-oncologist at Providence Saint John's Health Center in Santa Monica, California. I specialize in medical and psychiatric evaluation tailored to supporting patients who are experiencing the emotional distress often associated with a cancer diagnosis, treatment, and recovery. Joining me are Anna Rocha, nurse practitioner and head of our preventative care survivorship program, and Joseph Greenberg and Caroline Seraphin, our clinical social workers specializing in oncology who are skilled at psychotherapy tailored to cancer patients' issues and needs. And now we will start by hearing from Joseph and Caroline about oncology clinical social work services at Providence Saint John's Health Center.
Okay, hi, my name is Joseph. I work alongside Caroline, and we serve as the oncology social workers in the ambulatory cancer center at Providence Saint John's Health Center. We will describe how we aim to be strong advocates for you in your care and what specific ways we help. So what does an oncology social worker do, you might ask? People are often familiar with community social workers or those who work for state agencies. As social workers, we are members of the medical team specialized to provide support in the unique challenge areas that arise for someone going through the trajectory of a cancer treatment journey. We are here to listen and provide the best support we can along that journey. What does the first meeting with a social worker look like? Your privacy is very important. We work with you in the areas that you are comfortable sharing and talking about to get a full picture of the person, not just the medical condition, to be able to help support your access to the best care possible. We aim to meet with all patients near the beginning of their treatment in addition to the rest of the medical team as well. Things that typically help us understand a person's needs is learning about what their social support network looks like, how your work and finances may be impacted by treatment, and what factors are causing stress, and learn about the ways you currently help yourself to alleviate that stress. What are the specific things that social workers can help with? As an oncology social worker, we provide support in a wide range of areas. A main goal of ours is to provide emotional support, help manage stress that accompanies a cancer diagnosis, and refer to strategic resources ranging from lodging needs to supportive counseling. We will soon be going over those resources areas in more detail. You can also request to speak with an oncology social worker at any point. Just ask your medical team for a social work referral, and we will follow up with you.
Now we will move on to how oncology social workers can support you throughout all phases of your cancer journey, starting at your initial diagnosis, throughout your treatment, as you are handling side effects of treatment, and then as you are ending active treatment and entering into either the survivorship phase or perhaps living with cancer as a chronic disease. Cancer treatment is a journey and often referred to as a marathon rather than a race. Many patients find they need social work in varying degrees throughout their course of treatment. It is imperative to keep in mind everyone copes with a cancer diagnosis differently. It is not uncommon to experience various emotions throughout your cancer trajectory. You may experience depression, anger, fear, anxiety, difficulty making decisions, or self-doubt regarding your ability to cope. You may have worry about physical changes occurring during your treatment, fear of suffering, loss of control, and concern about your family's well-being. There are a variety of treatment options you may undergo as a cancer patient: radiation therapy, immunotherapy, chemotherapy, and/or surgery, just to name a few. Preparation for and the experience of cancer treatment itself involves many stages and emotions. Cancer and cancer treatment may cause a variety of side effects as well. Getting relief from these side effects is a vital part of cancer care. It is essential to talk with your healthcare team about the specific side effects you are experiencing and the best ways to manage and treat those side effects. We also have a palliative care team available. Palliative care can help minimize and manage symptoms that arise from cancer and/or the treatment. An oncology social worker will help ensure you have all the appropriate resources and referrals in place to make your cancer journey as smooth as possible. Keep in mind, the end of active treatment or coping with cancer as a chronic disease can also come with a wide range of emotions, and for some, many mixed emotions. If you are living with cancer as a chronic disease, you may have periods of normalcy contrasted by periods where you feel there is more recognition of the disease. Talk with your cancer care team if you experience difficulty coping. Remember that every person is different, and you can work with your cancer care team to find the best resources based on your wishes and psychosocial needs.
Moving on to support groups, exercise groups, and education resources. We are knowledgeable on referrals to beneficial support groups, exercise groups, and educational resources. Support groups are often specific to a person's condition and are currently being offered in a virtual and online formats during the pandemic. It can be powerful to meet with other people going through the same treatment, to not feel alone, to decrease isolation, and learn valuable insights into ways that others have dealt with similar challenges. If the group format is not a preferred method, there are ways to connect directly with another person with the same condition, as well as for spouses and caregivers to connect individually with other caregivers as well. There are healthy lifestyle groups like yoga, qigong, and light exercise classes that are shown to decrease stress, improve mood, and overall functioning, which serves to increase our body's natural defense systems against cancer and to become better at cancer fighting in general. We can also help with other logistical need areas such as advanced directives, things like transportation and lodging needs. Anyone over the age of 18 should have an advanced directive. This document is very important because it allows a person to identify a healthcare agent or decision maker in the situation that a person isn't able to communicate. It also allows a person to identify their healthcare wishes, which is helpful for both their families and the medical team to be aware of. We're able to provide this form and also answer questions about it. People often travel from long distances for cancer treatment and may also need referrals for lodging, which we can help with. There are short-term lodging options, some being income-based, that we can utilize. We can also provide guidance on navigating specialty transportation needs, like if one requires a wheelchair or does not have access to their own or a family vehicle and needs to come frequently for treatment.
Now, we will get more into the specific areas of support we can provide as oncology social workers. Oncology social workers offer a wide range of services ranging from short-term supportive counseling to financial assistance guidance. Supportive counseling can help you cope and manage distress better. Supportive counseling can help you process emotional and practical challenges that arise during treatment. It can also help you find ways to relieve stress, explore ways to communicate with your partner, children, friends, medical team, and employer. Supportive counseling can help assist in strengthening and developing healthy, positive coping skills. It may be helpful to gain further perspective on the challenges you are experiencing and vent to a neutral person. We also offer cognitive behavioral therapy, better known as CBT. CBT is a therapeutic approach available to our patients. CBT emphasizes the significance of how our thinking affects the way we feel. CBT is offered to our cancer patients because it can help you better cope with the stress of a cancer diagnosis. CBT can help you learn to manage your feelings, challenge any negative thinking patterns, and replace negative thinking patterns with more constructive ones. We will also provide referrals to community counseling if you require long-term therapy. Another common area we address that I mentioned earlier is financial guidance. The financial costs associated with a cancer diagnosis can feel very overwhelming. Oncology social workers can guide you to financial resources that help prevent financial toxicity. We commonly help patients navigate state and federal disability, family and medical leave, hospital financial support when eligible, referrals to our billing office to help create payment plans, and basic health insurance guidance. We can also provide some support locating financial assistance grants that assist with copays and cost of medication. If you are traveling for treatment, we can help you look into income-based lodging assistance programs as well.
Now, moving on to caregiver support resources as well as relaxation tips and techniques. When going through a cancer diagnosis, the spouse or partner and extended family of the patient also need their own support in both managing the challenges of the physical aspects of caregiving, which can be quite daunting, as well as the emotional component of dealing with the stress of a loved one going through a cancer diagnosis. We provide guidance on obtaining in-home caregiving resources such as private caregivers and how to utilize long-term care insurance when and if a person has this benefit. We also help provide emotional support and counseling to the spouse or partner as well, because they are a very important part of the patient's care team. One example of a coping skill we love to provide teaching on is increasing relaxation skills through mindfulness-based meditation methods. There are several different approaches to this freely available skill that is an important ability to incorporate to fight stress. By simply taking even as short as 3 minutes in a sitting to pause, focus on the sensation of breath or other neutral area of the body, and rest in the present moment, people can quickly notice the realm of calm they have access to at any moment. Please join me now if you're comfortable doing so in a brief meditation. Notice your feet on the floor, your back against the chair, and gently rest your eyes and settle in. Notice the calming sensation of your breath coming in and out. Notice that sensation. Just focus on the breath gently coming in and out or a neutral place in your body. And notice if your mind wanders or starts thinking or planning about something different. And when it does, gently bring your attention back to the sensation of the breath. Now come back to the present moment here in the room and stretch your shoulders and move your feet around and come back to this presentation. By starting a simple daily or weekly practice, a person can start to reduce the struggle with our own thoughts that we all have by starting to observe those thoughts more and more to change our attitudes towards them. To be more curious about them instead of being angry or anxious about those thoughts. Mindfulness helps to create distance from stressful thoughts with the act of observing them as being something like turbulent waves on the top of the ocean surface, viewed from the calmer depths just a few feet below in the ocean. Mindfulness also is an amazing tool because when you are focusing on a calm or a neutral physical sensation in the body, your brain cannot process the same thought or distressing thought or sensation at the same time. This activates the parasympathetic nervous system or the rest or relaxation system, and it deactivates the sympathetic nervous system, which is the fight or flight.
As we close our oncology social work portion of this presentation, we're going to offer some practical considerations patients have found supportive in the past. Ask for help and let people help you. Loved ones and friends appreciate being assigned a task and being able to help. Do not rely on Google. Use accredited resources if you wish to research your diagnosis at all. It is better to go directly to your medical team with specific questions around your diagnosis and treatment because your medical team knows you and your diagnosis best. Keep in mind there is a vast amount of information available on the internet and some of it is unreliable. Maintain a routine throughout your treatment. It can help provide a sense of normalcy. Talk with patients facing a similar diagnosis. It can be beneficial to speak with someone facing a uniquely familiar experience. And there are also resources available to connect you with other patients. Be an advocate for yourself. Ask questions about the care you are receiving. Discuss your concerns with your treatment team directly. Conserve your energy by prioritizing tasks throughout the day. Do the things that you need to get done when you feel your best. Plan rest periods throughout the day if you need to. Schedule daily relaxation time and incorporate lots of self-care. It can be helpful for some to use a worry journal A worry journal can help contain worry by allowing yourself 10 to 20 minutes of worry time daily. Use a journal to record your worries. After allowing yourself to worry, feel bad for the allotted amount of time. Thank yourself, close the journal, and then try to reject worry thoughts for the rest of the day. You can say to yourself, I have already worried about that. I can worry more about it tomorrow. Or no time for that right now. Or stop and use some distraction skills. It will take practice and time to turn away from worry outside of your allotted time. Ask yourself, how much worry time do I really need each day? A worry journal allows you to practice good mental habits. Make the most of your medical appointments. Bring someone with you. Let the person know ahead of time how he or she can be most helpful to you during that appointment. It may be helpful for someone to take notes as you speak with your doctor, or simply just be there as a source of support. Exercise in accordance with your medical team's recommendations, of course. Moderate exercise, such as 30-minute walks a few times a week, can help lower stress and fight fatigue. Take the time to learn a new hobby. It can act as a positive distraction and provide a sense of fulfillment. Thank you so much for your time. We hope you found these practical considerations useful. I hope you have gained a better understanding of how an oncology social worker can help you throughout all phases of your cancer journey. Remember, don't hesitate to talk with your cancer care team when you are feeling distressed or experiencing difficulty coping. Remember that every person is different, and you can work with your cancer care team to find the best action to take based on your own situation and psychosocial needs. I will now turn over the presentation to our wonderful psycho-oncologist, Dr. Gavin Nathan.
Thank you, Joseph and Caroline, for that great presentation. Now, I would like to talk about psycho-oncology and specifically cancer psychiatry. What is psycho-oncology, first of all? Psycho-oncology as an umbrella is a field that encompasses everything that I do, as well as what Joseph, Caroline, and Anna do to help patients. Traditionally, psycho-oncology is defined as a supportive care that addresses the emotional, spiritual, physical, and social well-being of a person with cancer. Put more simply, psycho-oncology as a field looks at how we can promote well-being by addressing the person within the context of not just their illness, but also their life. One of the most important first steps is the recognition and validation of the patient's experience. So every person experiences cancer differently. There are people who will actually not need our services because they go through cancer treatment, they go through everything in their cancer journey, and they have an experience that they are able to incorporate in a healthy way into their life, and they are able to move on without too much trouble. However, that is not everyone's experience, unfortunately. I like to sit with patients and really look at what has changed since cancer. So I get a sense of what their life is now, and I get a sense of what their life was at the worst times when they were under treatment. And I try to get a sense of who they were before cancer. And then I see my job as working with the patient to incorporate who they were and who they are now in a way that allows them to get back to living. It's not an easy thing to do, but I think it's important for us to get to the other side of whatever treatment we're going through, or get to the other side of whatever step in our cancer journey we happen to be in, and still find joy in living, still find reasons to get up in the morning, still find that there are moments where we don't have to think about our cancer, where we can think about living only and really enjoy ourselves. So that's my goal for patients. And, by sitting down and looking at the change that has happened since cancer, and not every change is bad, but if we look at the changes that might be deficits or might be places where the patient feels like they have holes in their well-being, I like to discuss how we can recognize the symptoms that are being caused by these changes, whether it's in cognition or how we sleep or how we eat. And then we do the work of figuring out how to treat these symptoms so that patients can heal fully, so that patients can recover. It's not always easy, but I do find that when you sit with a patient and you validate their experience and you validate what they're going through right now, and you also are able to connect physical symptoms with a reason. Some symptoms are coming from treatment, some symptoms are coming from where the cancer was, and some symptoms are coming from the fact that the brain and the mind don't love undergoing these treatments and don't love what they have to go through to get to the other side of cancer. So sometimes just recognizing that a person's brain or their mind has changed because of their cancer and because of the treatment is helpful to people, because then we can really sort of do a deep dive into what symptoms are causing the stress and then go about fixing them. And I think patients are relieved to find that the large majority of symptoms are, number one, not only their symptoms, that there are other patients who are going through the same things, and these are symptoms that we recognize as patterns over and over in treatment. But then also that there are treatments and we can get better. We can get back to living and spend less time sort of struggling with recovery. So that, in essence, is what you can expect when you come to see me. Many of my patients have never had to see a psychiatrist before, and many of them have never had to take any kind of medication to help them with symptoms. And so I see my job as helping people to understand where they may need some support, either from behavioral treatments or therapy or from medication. How can a psychiatrist specializing in cancer help? So one of the things that people will ask me is, why do I need to see a psychiatrist who specializes in cancer? And to be honest with you, not every single patient needs someone who is specialized the way I am. But we do have to recognize that psychiatric illness, when it occurs in the context of cancer, has marked differences sometimes in the cause of the symptoms, in how symptoms present, and in treatment. Now, the nice thing is that anxiety, depression, and insomnia, which are the most common illnesses and complaints that are seen in general psychiatry out in the world, continue to be the most common complaints across the board, no matter what kind of cancer. And they are all highly treatable. So why is this important? It's important because we have a lot of work to do when we are diagnosed with cancer and when we are undergoing treatment and when we are recovering on the other side, or if we are not going to be cured and if we are going to have to find ways of living in peace with our cancer. No matter what, we have a lot of work to do. There's a tremendous amount of energy that goes into getting better from cancer and from cancer treatment. So in my mind, we don't need the added burden of anxiety or depression or insomnia. And since we know that these particular sort of mental disturbances are actually highly, highly treatable and do respond to medication and do get better, the way I look at it is that that's a burden that my patients don't need to carry. I have to walk with them through their cancer treatment, and those are things that they have to do. Chemo is something that some people have to do in order to get better, or radiation, or surgery, and they're all stressful, and I wish I could take them away from my patients, but I can't. But what I can do is make it a little bit lighter by getting rid of the anxiety or the depression or the insomnia or whatever else is sort of clouding our mind and clouding our brain and taking up energy that we don't need to waste. So other symptoms that patients complain about are cognitive symptoms, what people like to call chemo brain, something called mood lability. So mood lability is mood that goes up and down in an unpredictable sort of way. And it's not over weeks to months, it's over hours to minutes, days, it depends. But it's kind of a really surprising overreactivity. We don't know when we're going to be irritable. We don't know when we're going to freak out about something. We don't know when we're going to get hugely upset and be kind of watching ourselves and thinking, why am I getting this upset about this? But we can't really stop it. So that's mood lability, and that's something that people commonly complain of after they've been exposed to chemo, radiation. In terms of breast cancer, sometimes when people are on the aromatase inhibitors, this becomes an issue. Poor executive functioning is, I like to say that the personal assistant who sits in our head, writes things down, and makes plans for us, has absconded, has left their job. So, and if you're trying to get back to your life and you have a job or you have children or you have an elderly family member that you're taking care of, and you need to be able to use your brain to plan your days and get things done, poor executive functioning can be very, very debilitating and very frustrating for patients. There's another symptom that people complain about often, and that's hypersensitivity to stimuli. This is, I commonly describe this to patients. I'll say, it's when the phone is ringing, the dog is barking, and someone says something to you at the same time, and you kind of lose it because there's too many things coming in, and the brain really can't assess which one of these is important, which one should I listen to first. So the brain listens to everything at once, and we get overwhelmed. And this sort of cluster of symptoms right here, the cognitive symptoms, the human brain, mood lability, poor executive functioning, and hypersensitivity to stimuli, these symptoms tend to present largely in people who have gotten chemo and radiation, or in breast cancer patients who are on aromatase inhibitors. And these are the symptoms that nobody really realized were symptoms. And it's really nice to be able to tell people, hey, it's not just that you are lazy now, and it's not just that now all of a sudden you're stupid, because you're not. These are actual, quantifiable, treatable, known sequelae of getting radiation chemo or being on aromatase inhibitors, or many other medications can also cause it. So overall, we can treat the anxiety and depression and insomnia. And, most people aren't too thrilled about having to take medication for that if that's how we choose to treat it. But it does change the outcomes. We have study after study that shows that if we treat people's anxiety and depression, their outcomes in terms of cancer, not in terms of their psychiatric illness, but in terms of cancer, their outcomes are better. They've done extensive studies in breast cancer patients that show that anxiety and depression, when treated, can not only change the outcomes immediately after surgery, or radiation, or chemo, but also change the rates of recurrence. And these same studies have been replicated in many other cancers, lung cancer. More of the information is coming in now in terms of melanoma, and some of the GI cancers as well. We know that the gut and the brain are very connected in terms of mental function. And so it seems that treating these symptoms really helps with the cancers that involve the gut. So overall, if there's one take-home point from this talk, I would love for people to sort of make the connection between treating our emotional and cognitive symptoms and having better healing and having better outcomes. Because truly, it does make a difference. We do get better faster. We do feel stronger. My patients sort of rise after we treat them, and that's what we want. It's really rewarding, and it's really beautiful to see. And even patients who are sort of living with their cancer, and the cancer may not go away ever, there's so much we can do to give people back the living part of their life, and the enjoyment and the pockets of joy by treating these symptoms. So that's why we need a cancer psychiatrist. It's really important to treat these things and not have this be the reason why you don't get better from cancer. I just wanted to share this slide These are some of the therapeutic interventions that a cancer support team can offer. All of these, I'm happy to say, are larger cancer support team offers. And I wanted to highlight this because I'm not sure that everyone always knows how much can be done to help and how much can be done to change the symptoms that may be getting in the way of someone's healing or recovery. So I bolded the first three because that's really the part that I do. One of my jobs is to figure out which medication might be helpful, but also, have an understanding of where the cancer might be, what the liver is doing, what the kidney's doing, what the brain's doing, and making sure that any medication that I'm giving you doesn't interact with the medications that are being given to treat the cancer, making sure that the liver and kidney can handle whatever medication we're giving. So I'm usually, digging very deep into the chart and figuring out what exactly is going on with the body as a whole before I prescribe. Another thing that I think is really important is psychoeducation because, as I said before, many of the symptoms that present are on the more subtle side, and people just think that that's how they are now, and they don't realize that these are treatable symptoms that can be changed. And then a large part of what I do is also communicating with the primary oncology or surgical team. I like to say that the reason why I went into psychiatry is because there was no other specialty that would pay me to spend time with patients. And it really is true that I get to spend a very sort of luxurious amount of time with people. And so there are symptoms that come up, or someone has a rash, or someone isn't tolerating a medication very well. And I get to find out about those things because I spend so much time with my patients. And so one of the important roles that I have is going back to the primary team and letting them know, sometimes even in real time, I will pick up the phone and call an oncologist and say, listen, patient's here today, and I'm a little bit worried because there's a rash, or I don't know if you knew, but she's been throwing up all night. And things like that are really helpful because it allows us to get treatment and get answers in real time. And I'm happy to do that for my patients. And it does seem to decrease the anxiety around the symptoms. So I see it as a psychiatric intervention, but hopefully it also helps people communicate with their team better. On our team, we also have opportunities for group psychotherapy. We're in the development stage of CBT for insomnia. This is cognitive behavioral therapy for insomnia, which has been proven to be as helpful as medication, if not more so. And it's certainly less dependence forming than medication. So our social workers, Joseph and Caroline, are working on creating that program for our patients, and we are very excited. We hope to roll that out soon. We also have individual therapy, and if we are unable to provide individual therapy on a long-term basis in our program, or if patients are getting better and they're able to go outside, we also will help them find resources out in the community. We can also get patients neuropsychiatric testing. This is more for the cognitive issues. If the cognitive issues are getting in the way and we need some diagnostic finesse, we need to know exactly where the person is having issues, especially if it's on the more subtle side. Neuropsychiatric testing can be very helpful, and I can order those tests. Cognitive rehabilitation is something that has sort of come up in response to chemo brain and radiation brain, and it is something that is also being used in dementia patients with success. Now, the nice thing is that in my patient population, many of them get better in terms of their cognitive symptoms on their own. But if they want to sort of work on how quickly their brain is thinking, memory, recall, some of the things that might get a little fuzzy during treatment, we now have the ability to offer them cognitive rehabilitation services to help with that. Behavioral interventions are so important. I call this the scaffolding. I never like taking medication myself. So I never want my patients to have to be on medication longer than they have to. And so what I say is the medication is kind of like the crutches. I think in the slide before I had a picture of a man with the crutches over his head. And that's my goal. My goal is that I will provide you with the crutches during the time when you're healing, and the medication access those crutches. And then what we want to do is build in behavioral interventions that create a scaffolding and make you stronger. And so eventually you don't need those crutches anymore. So yoga, mindfulness, meditation, wellness, integrating things into our life that we probably should have been doing all along, but we never really had the time to. And now, we've been stopped by this illness, but the silver lining might be that we finally pay attention to what our body and brain might need to be their best. So that's something that I am always working on with patients. Nutritional optimization, we're very lucky. We have a lovely nutrition department, and we also have been blessed by donors and philanthropists who have given money in recognition of the fact that cancer patients do need nutritional support. So we're able to offer an initial consult and a follow-up consult for free for any patient who needs it. Obviously, you've met our lovely social workers, and they do amazing work with patients on multiple levels, as they described. Pain management is really important. We cannot have quality of life without pain management, and we work closely with the palliative care team. They are a part of our larger team, and we do have them coming into the cancer center to help patients with pain. And chaplaincy, I would say that St. John's has one of the loveliest chaplaincy programs. The spiritual care program is just so sort of mindful and sweet and loving. I get calmer in their presence. So, and they're going to do a talk later on about their work, but we work closely with them as well when patients are in need, because our services definitely work hand in hand. So that's the larger team that helps people to get to well-being, and I'm just one cog in that sort of big wheel. But I really do hope that people will think about it and consider that if you are suffering from symptoms of depression or anxiety or insomnia, if you are feeling like your brain is not your own anymore, or you're not understanding why you're unable to do things that you could do before, or if you're just sort of stuck or not coping, these are things that we help people with, and they are treatable things. So if you could take one thing away from this, I would like for people to consider that much of what we go through, much of what we think we have to hold on to and we have to go through by ourselves, a lot of it, as you can see from this, sort of extensive list, a lot of it is not something that you have to do alone, and a lot of it is highly treatable. So I hope that my talk convinces people to take a second look and see where the holes might be. And on your journey to well-being, come and see if we can help you. Thank you. And now I'm going to turn it over to our wonderful nurse practitioner, Anna Rocha, who runs our preventative care and survivorship program, so that she can talk a little bit more about that program.
Hello, everyone. My name is Anna Rocha, and I am a nurse practitioner. I started my journey in oncology 15 years ago as a nurse. I worked in the hospital and took care of people with cancer and their families. I then went on and worked in the outpatient side, where I worked as an infusion nurse, giving patients their chemotherapy or biotherapy injections, etc. Then I switched and worked alongside the oncologist in the clinic, helping to see patients. And now I work alongside Dr. Gary Nathan, Joseph and Caroline, many oncologists and surgical oncologists. My focus is on survivorship and collaborative care, and I'd like to talk to you a little bit more about that. Our objectives today are to go over common myths and misconceptions, who is a cancer survivor, survivorship care, stress, anxiety, and depression in survivors, and collaborative care for survivors. Common cancer myths and misconceptions. I've heard this many times before when there is a new diagnosis. Cancer is a death sentence. In the United States, the likelihood of dying from cancer has dropped significantly since the 1990s. Many factors play into these statistics, and one size does not fit all. There have been many advances in treatment of cancer. And so whether you're early stage or late stage, cancer doesn't always mean it's a death sentence. How about sugar causes cancer? I've heard this so many times before, and it's simply not true. However, obesity does increase the risk of developing certain types of cancer. I've heard this too. No one in my family has it. Why do I? Or my family doesn't have it. I'm risk-free. Also not true. In the United States, women have a 1 in 8 chance of developing breast cancer, and men have a 1 in 9 chance of developing prostate cancer. And this is why cancer screening is so important. We have to follow these guidelines. How about a negative attitude cause my cancer? A bad or positive attitude does not cause cancer or determine your recovery. Can stress make it worse? Yes, and we'll discuss this a little bit more later. If I ask for help, I am weak, or my cancer wasn't as bad as this person's cancer, or I am alone. So these are a lot of the common sentiments that I hear from people with cancer and their families. In the United States, there are almost 17 million cancer survivors. So who is a cancer survivor? A cancer survivor is anyone who has been diagnosed with cancer, and it starts from the moment they are diagnosed. So this is before you start treatment, or if you finished treatment 20 years ago, or if you're in the middle of treatment. So you are a cancer survivor, regardless of what stage you are, what phase you're in. It is living with, through, and beyond cancer. And family members, friends, and caregivers are considered co-survivors. Because what we know is that cancer affects families and friends, not just the person with the diagnosis. It can affect relationships. Family may feel worried or guilty or not know what to say, sometimes even feel helpless. So now that we've identified who is a cancer survivor, let's review what is survivorship care. A person with cancer has needs that are different than that of the general population. There are about 13,000 oncologists in the United States providing cancer care. They provide that service out of various locations such as private practice, hospital-based centers, and standalone cancer centers. There are national guidelines for what resources and services a survivorship program should offer to people with cancer. The new standard requires that at least a minimum of 3 services be offered. And what we have at Providence Saint John's is a very robust program. We have registered dietitians to help guide and provide education on what to eat while you're on treatment. We also have support groups. We have genetic counselor available as well, spiritual care, physical activity program with yoga and qigong, although they've been a little bit sidelined, a little bit different because of COVID. We also have streamlined referrals, cancer rehab to help regain strength after treatment. We also have psychiatry, and regarding the financial support advocate, our social workers do take care of some of that right now, but we are looking to fill that position soon. So that will be solely focused on financial support. So I am really proud of our program here at St. John's because we have created a dynamic model of care that incorporates a multidisciplinary team that works closely with the oncology team to help ease the way. The cancer journey is often not an easy one and requires much support from various disciplines. So we have a lot of specialties here, and we really hope to embrace the patient and help them along as they go through their treatment. Treatment summary and care plan. I like to think of this as where you have been, where you are at present, and a written plan for what's to come next. The treatment summary is a comprehensive, detailed record of what you've had done. The treatments that you received, such as chemotherapy, biotherapy, the name of the drugs, the dose that you received, how many cycles you received, any clinical trial information, or radiation you received, the dose, the site, and any surgeries that have been done. It's also a way to identify and manage the long-term or late effects. So now that you've had surgery, what do you need to watch for? Or what could be these long-term or late effects? If you've had chemotherapy, should you expect any neuropathy going forward? What about lymphedema? So these are the things that we review as we go through the treatment summary and the care plan. It will also be a list of what your future follow-ups will consist of. Will you be coming back every 3 months or every 6 months, or will it be once a year? It's different for everyone based on their stage and the type of treatment they received, as well as the type of cancer that they have. We also review other wellness screenings. So for some time, cancer may have been in the front seat, and so maybe the blood pressure, took the back seat, or the blood sugars took the back seat. But this is a time to really go back and look and see to make sure that you're on track for everything else for your wellness screening. We also make sure that, if you've lost weight or if you've lost function, that we help you with that and provide you with the correct referrals, whether that's to cancer rehab or a registered dietitian, because we really want to help you live your best life. This information is really invaluable to the patient, their primary care provider, and to really help with continuity of care. I'd like to go back to the previous slide. The survivorship program, I've highlighted other sections that I'd like to talk a little bit more about. The licensed counseling, psychiatry, education, support groups, streamlined referrals, and financial support. We know that life can be stressful, and stress can be positive or negative. Some stress is good, as it helps us to respond to emergencies when needed, the fight or flight response. Relocating, starting a new job, or losing one, getting married or divorced are difficult situations. Feeling sad, lonely, or scared are normal reactions to life stressors. There are peaks and valleys, and this is normal. Sometimes medical conditions such as diabetes or thyroid dysfunction can cause hormone changes that can also lead to some of these feelings. I have heard time and time again that these are unprecedented times. Life, COVID, election, riots. Adding cancer to the mix can make those valleys or low mood more frequent. So when the low mood persists daily over more than a couple of weeks or gets worse over time, this can impact work, it can impact relationships, it can impact functioning, and it may be time to find help. I'd like to talk about collaborative care. Did you know that 1 in 3 people with cancer have experienced depression and/or anxiety? And the incidence of this actually goes up if someone already has, say, for example, diabetes or high blood pressure. I think these numbers are much higher than this, but we often don't screen for these feelings because the focus is really on cancer and the treatment. Chronic stress can increase your heart rate, your blood pressure, cause digestive problems, and make you more prone to infections. So what we know is that depression or anxiety can occur in 40 to 50% of people with cancer. It can have negative effects on your health. How we can help. Collaborative care is really a program that has been designed to help people with cancer. We know that during this time, you're just trying to make it to the doctor, get to your cancer therapy, and get through the treatments. So having a specialized team focused on helping with the emotional and social toll of cancer embedded right in the cancer center can be a real lifesaver. The program was designed to improve mood and decrease anxiety in the hope that it will preserve or improve resiliency while going through those valleys that can present at various times during your cancer journey. So we can help teach coping skills in cognitive behavioral therapy. We can also consult with a psychiatrist, Dr. Gary Nathan, who can make recommendations. We want to work together with you to treat, identify, and monitor your response. And participants often feel less depressed and anxious in just a couple of months. We will work with you to provide the tools and techniques on how to cope. I'd like to read an excerpt from an article titled Dealing with Survivor's State of Mind. by Jeanette Moninger. I couldn't process anything that was happening, says the now 28-year-old. I focused on what was needed to get through treatment. I no longer had frequent visits with my oncologist. Friends and family checked on me less and less, and there I was, bald and extremely fatigued from chemotherapy. Now I'm told to go and live my life again. And that's when I fell apart. Many people with cancer go through these same emotions, and so survivorship care and collaborative care can be a bridge. So how do you know if or when you need extra help or support? Oftentimes, you may feel you've lost your joy or feel detached. You may have trouble concentrating, feeling tense or restless, feel easily annoyed or irritable. You may be eating too much or too little. You may be having thoughts of hurting yourself, or if you're sleeping too much or too little. You might be feeling guilty or bad about yourself. You may have racing thoughts or feel overwhelmed. Sometimes these emotions and feelings can last far longer than the effects of any cancer therapy. And so this is why I really believe in collaborative care. I love to meet with patients, hear their stories, and find out what's important to them. How can we best help you? How can we help your family? The other two misconceptions: you are not weak if you ask for help, and you are definitely not alone on this journey. Having a positive attitude can help, yes, but more importantly, having the resources, having the tools, and knowing when to ask for help is most important. Both collaborative care and survivorship care focus on prevention. It's education for the mind and body towards recovery with advocacy and compassion and excellent care. So I hope that you have learned something from this program. Learn to ask too what resources are available where you're getting cancer care, and advocate for yourself and others so that survivorship and collaborative care can be available equally for everyone. We really want to help people feel as well as possible, even when there is a cancer diagnosis. Remember that survivorship is more than surviving, it is thriving. Our goal is to break down those barriers and bridge chasms from fear and suffering to resilience and thriving. Thank you for your time and attention, and I'll leave you with my last slide of resources. These are quality, evidence-based, reliable resources. Thank you.
Thank you, Anna, for that great presentation. And now we will address some of the questions that have been submitted throughout the program.
We have some questions here. The first ones are actually for the social workers. You know what, Caroline, do you want to address the question about lodging first?
Yes. So there was a question about whether we can help patients and their families with lodging. And the answer is yes. As oncology social workers, we can help patients and families find appropriate lodging resources. Would have to talk about your specific situation because many of the programs are income-based, but we could definitely talk about that with you and find an appropriate resource to help you and your family with lodging as you're traveling here to St. John's for cancer treatment. We also have compiled a thorough list of hotels in the area that offer medical discounts to our patients, so we could provide that to you as well and talk through some of those options. We also look into general financial resources for patients that can just help offset the cost of lodging. So those are all options. So that's definitely something we help with as oncology social workers, if that answers your question.
Yeah, thank you. Thanks, Caroline. And we have another question for social work here. You mentioned to talk with your cancer care team to receive support services. Can you explain what kind of people would be in the care team for patients? Is social work a part of the team? Joseph, you want to answer that one?
Yes, happy to answer that. And yeah, so in addition to your primary team of your oncologist, nurse practitioner, or physician assistant, the nurse, the medical assistant, there are many other specialties that are a part of the care team. We've talked about some of those throughout the talk. I'll repeat them again here as well. So a part of that support care team would include dietitians, the palliative care team for help with pain management, as well as kind of discussion of goals, physical therapy, occupational therapy, as well as spiritual care chaplains, also a part of that team to help patients. And this obviously includes us, the social workers, Anna and Dr. Gowrie-Nathan as well, all being a part of your care team. We stay in constant communication with your primary team to get the most up-to-date information and to be best informed and to be able to help. And I always like to say that our support is included in your care at St. John's, and we're honored to be a part of your team.
Thanks, Joseph. This one is a really good one. Anna, you can have this one. How has the pandemic affected mental health?
Right. So, you know, again, these are definitely unprecedented times. I have seen more stress in the people that we treat and in their families. The isolation alone, not being able to see your loved ones, having to quarantine, being at risk, having cancer if you're on treatment that's going to suppress your immune system is also a very big fear among our population. So yes, it has definitely increased depression, anxiety, insomnia, all of the above.
Yeah, I would agree.
Mm-hmm.
And I think that in some ways, cancer patients have been better prepared for the pandemic because the concept of sort of your world turning upside down and having to be extremely aware of getting sick and being around other people, those are things that cancer patients have already dealt with. But I think the part that has become very difficult is not being able to have our loved ones when we come for treatment and not being able to see people as often. You know, the extreme social distance, I think, is taking a toll. But, you know, I feel like our patients are really resilient. So I think they are managing. We're getting through, all of us together. There's one other question here. If I see a psychiatrist, do I have to take medications? No, we can talk. You know, psychiatry, in my mind, is really about treating the whole person. I don't think that medication is the beginning or the end of treatment, and I really see it as one of the augmenting tools that we have in our toolbox. And some of my patients are sort of really, really vested in doing this without medication. And then we find ways of making that happen. I do think that I'm very lucky to have Anna and Joseph and Caroline, because there's so many different modalities that we can offer patients because we're this diverse team of people, you know, from psychotherapy to sort of nutritional augmentation with Anna. We can really look at alternative treatments. And one of our goals with the program is to really build more modalities of treatment into the program so that we can have something to offer for everyone, not just traditional psychopharmacology. But that being said, the medications do help sometimes. Thank you for that question. Do you offer virtual support services? Yes, we do, because the sort of silver lining of the pandemic is that we have been able to really augment our telepsychiatry, telepsychology programming. We are seeing patients via Zoom. We are seeing patients in their homes. And this has been sort of a boon to us because we don't always want people to be dragged in to clinic to be able to talk to us. And sometimes when people are really not doing well, the last thing they can do is come see us, but that's when we want to reach them. And we used to do that by phone. We used to reach out to people when they were in crisis by phone, but it's really nice to be able to see people's faces and their pets. We see a lot of people's pets too. Mm-hmm. Oh, this one's so nice. Thank you, Dr. Gowrie-Nathan, for being down to earth and relatable. I think for those of you who might need our services, I think our team is a really special team because we go out of our way to be the people that you can approach. And we do that not just for the patients, but for the really lovely people who work in the Cancer Center as well. We try to be there for all the caregivers and care providers in the Cancer Center, as well as our patients. But thank you for noticing, because we try really hard to be the people that you can approach and you can get help in a number of different ways. I don't know if there's any other comments or questions. Anna, Joseph, Caroline, do you guys have anything to add?
No, thank you everyone for attending, and you can reach out to our team with any additional questions. We did post our contact information in the last slide.
Yes, we do have that. And then we are also reachable through the website. If you go to the website, you can find all of us, our names and our emails. And you can get a hold of any one of us in order to get a hold of the whole team. We're always here. Thank you guys so much for joining us and for listening. Yeah. We really appreciate it.
Thank you.
Thank you.
Thank you.
Bye.